a new scientific review says there is no evidence that mask mandates had any impact on curbing the transmission of COVID-19. Now, this is what the CDC and WHO were all about, but yet they want us to give them more power over our lives when the studies are showing what they pursued didn't work. Now, this directly contradicts months of claims from the Center for Disease Control. In April of 2020, their director at the time, Dr. Robert Redfield, testified before Congress saying face masks are the most important, powerful health tool we have. Wait for him to retract that. All right, joining me now to talk about this and more is an academic clinical trialist and epidemiologist, Dr. Andrew Bostom. Dr. Bostom, welcome back to Washington Watch.
Thanks for having me on again, Tony.
So, surprised by the results of this study?
No, they actually confirm exactly what the randomized controlled trial data. So they're really just pooling together the randomized controlled trial data that have emerged about certainly community masking, but they even went into the issue of masking of healthcare workers and comparing medical surgical masks to higher quality N95 masks. But this literature on an individual basis has been available for anyone to read. There have been some earlier pooled analyses, particularly of the flu literature, since it was an older literature. The SARS-CoV-2 literature is newer, and they're just basically aggregating existing randomized controlled trials. And remember, Tony, the only unbiased estimate we can get of an intervention, whether it's a complex intervention, medical intervention, or a simple intervention like a barrier, like a mask, is through randomized controlled trials. And it doesn't matter what these highly biased, poorly designed observational studies show. This is the gold standard that we use for evidence-based medicine. And in fact, the Cochrane Review is really at the pinnacle of this entire process, of the process of synthesizing particularly randomized controlled trial data. So when they put their imprimatur on a study like this, it is about as definitive as you can get, Tony. And to hear Rochelle Walensky get up in front of I forget exactly which hearing it was, but it was very recent. After she was questioned, I think it was by a congressman from Alabama. She was questioned about this, precisely the Cochrane Review, and she jumped. Oh yes, I know that very well. The problem with it is that we didn't have equipoise. In other words, there wasn't a question about whether masks worked or not. We knew they worked, and this you have to understand, this turns the whole principle of equipoise on its head, because equipoise is the situation that exists before randomized trials. Right. When randomized trials are as definitive as this, there's no longer any equipoise. There's no longer any indecision. And she just turns the whole concept on its head. It was stunning.
So these studies incorporated almost 300,000 people. So I mean, there's a lot of folks involved in this. Right. So you may have heard part of the conversation I had with Dr. Bell about the WHO wanting more power to mandate what countries do when it comes to a pandemic. And they were the ones, along with CDC, pushing this type of stuff, the vaccines, which we now have questions about. So why are we giving away our sovereignty and our power now that we have this evidence that shows they had the wrong policies in place and they wouldn't listen?
It's frightening, and Dr. Bell is an authority in the sense that he has hands-on experience working with the World Health Organization, and he can't really understand how things have gone awry. I think one of the obvious reasons may be the burgeoning influence of communist China. I mean, after all, they seem to be directing WHO's policy, which sort of lines up with this kind of action. I mean, the so-called Chinese standard for handling SARS-CoV-2, which was an abysmal failure, is what now would be, I guess, promulgated through the WHO for all kinds of infectious diseases and other situations. And of course, I'm sure the worst restrictions China will be exempt from. Just
Right.
like when it comes to climate change,
Right.
they can pump out as much carbon as they
Well,
want.
they're all about selling the mask and everything else because they manufacture
Exactly.
them, and they're going to make a
Exactly.
profit off of them. Do you expect to see anyone who was pushing this to say, "Oh, we were wrong. We shouldn't have done this"?
I hope against hope. Maybe I'm very naive. I actually thought that Dr. Walensky might have, a mea culpa, but she just sort of digging in her high heels, and I don't see any of the rest of them being any different. I mean, the New York Times, there was, and at least it's just one of their editorialists, Brett Stevens. He took a hiatus from, I guess, bashing Trump Republicans to weigh in on masking. But that is actually, all kidding aside, that is quite a milestone that the Times was even willing to publish an op-ed which basically just echoed the findings from the Cochrane meta-analysis.
So will these, I mean, we're already seeing this in California where they're saying we were going to put the mask back in place, the mask mandates. Do you see people taking this type of information and fighting these mandates from local jurisdictions?
I think so. And I'm involved. I'm in a very, very blue state here in Rhode Island, and parents have been fighting a mask mandate that went into place during. It's been lifted since, but the case is still ongoing, and there's going to be hopefully a very interesting settlement on Monday of this week. Either way, I think the parents will win based on what I understand of the settlement. And I think if a state like this can have a grassroots movement that opposes these really failed draconian policies with regard to masking, then perhaps the sky's the limit.
Well, it's going to take more people standing up and saying, no, we're not doing it. Science is on our side. You who follow science. Dr. Bostom, always great to talk with you. Thanks so much for joining us today.
Tony.